You know that feeling, right? You're at the doctor's office, or maybe you're just watching a TV show and you hear a medical term that sounds, well, completely impossible. It just feels like a sea of jargon. Today, we're going to change that, right? You hear some long, complicated word, and your brain kind of just stops. It can be really intimidating, even a little scary, especially if it's about your own health. But what if I told you there's a secret key to understanding almost all of it? Okay, look at this word, pancytopenia. Right now, it probably looks like a jumble of letters, something you just skim over. But I promise you, by the end of this little guide, you're going to be able to look at this word and know exactly what it means. Seriously, just stick with me. So here's the secret. These huge, scary words, they're not really single words at all. They're more like tiny sentences built from smaller, reusable parts, kind of like Legos. And today, we're going to focus on the first and maybe the most important building block of them all. It's the prefix, the part that comes at the very beginning of the word. And this little piece often gives away the whole game. It can tell you where, when, how much, or what kind. If you can master just a few of these, it's like having a decoder ring for the entire language of medicine. So, what's the best way to get these to stick in your brain? Well, it turns out learning them in pairs is a game changer. So, we're going to start with prefixes that are direct opposites. Thinking of them like a balancing act makes them so much easier to remember. First up, we've got a classic pair, hyper and hypo. You've probably heard these ones before. Hyper just means high or excessive. Think hypertension, which is just a fancy way of saying high blood pressure. And its opposite, hypo, means low or below normal. Like in hypoglycemia, that's low blood sugar. See, one is too much, the other not enough. Simple. Next up is all about speed. Tachy means fast. If a doctor says someone has tachycardia, it just means their heart is beating way too fast. On the flip side, you've got brady, which means slow. So bradycardia is a heart rate that's too slow. Just think of a tachometer on a car revving high for tachy and hitting the brakes for brady. And how about time? This one's super intuitive. Pre just means before, like prenatal care, which is all the stuff you do before a baby's born. And post means after, like in post-operative care, the recovery period after a surgery. Before and after. That's it. All right, let's keep building. This next group of prefixes is basically a GPS for your body. They tell you exactly where something is happening, which is, pretty important. First up, endo. This one means inside or within. You've probably heard of an endoscopy, right? That's literally a procedure where doctors use a tiny camera to look inside your body. So whenever you see endo, just think internal, inside. Next, epi. This means upon or above. The perfect example is your epidermis. The dermis is a layer of your skin, so the epidermis is the layer that sits right on top of it. It's the outermost layer, your body's first line of defense. So if epi is on top, what about underneath? That would be sub. It means below or under. Think about a submarine going under the water. In medicine, a subcutaneous injection is one that goes just below the surface of the skin. Okay, so we've covered inside, on top, and below. But what about the space between things? That's where inter comes in. It means between. For example, your intercostal muscles are the ones that are located right between your ribs. And last up for our GPS tour is peri, which means around, like the word perimeter. The pericardium is the protective sac that is literally found around the heart. It's a perfect description right there in the name. Okay, our last big category of prefixes is all about quantity. These little guys tell us how many or how much of something there is. It's basically like learning to count, but in the language of medicine. This one follows a really nice logical progression. We start at 0 with a or an, which means without or a lack of. Think of anemia, which is a lack of healthy red blood cells. Then we just count up. Mono means 1. Bi means 2, like bilateral, which means it's affecting both sides. And poly means many. From none to many, it's that straightforward. All right, you've learned the building blocks for opposites, for location, and for quantity. Now for the really fun part. It's time for the payoff. Let's go all the way back to that crazy-looking word from the beginning and use our new decoder skills. Remember this? Pancytopenia. Let's break it down. Pan is a prefix we didn't cover, but it means all. Cyto is a very common root word for cell, and penia is a suffix that means a lack of.
So put it all together, pancytopenia is a lack of all types of blood cells.
See?
It's not some scary monster of a word, it's just a description. Let's do one more real quick, using a prefix you did learn, endocarditis. We know endo means inside. You probably know cardio has to do with the heart, and itis is a super common suffix that just means inflammation. So endocarditis is an inflammation inside the heart. Look at that, you just decoded 2 complex medical terms.
And here's the most important takeaway. You don't have to be a doctor to get a handle on this language. By just learning a handful of these prefixes, these little building blocks, you've given yourself the power to understand. You can decode the words that used to seem so confusing, and that's a pretty powerful feeling.
You know, this way of thinking, of breaking big things down into their smaller, understandable parts, it doesn't just work for medicine. It works for law, for science, for technology, pretty much everywhere. So I'll leave you with this. Now that you know how to look for the building blocks, what other secret codes are you ready to crack?